Hi, thank you for joining us today. I'm Shelley with the Revival Education Team, and today we have Dr. Marty Greer, Director of Veterinary Services with Revival Animal Health, joining us. And a lot of things going on right now, and we're going to talk about what this all means for pets and pet care and what we can do to help ourselves stay healthy and, of course, our pets. Obviously, it's a time of uncertainty for all of us. And so at Revival, we want to make sure that you know that we are here for you. We're here to help, answer your questions, continue that education, and obviously provide the products that you and your pets need. So, Dr. Greer, obviously COVID-19 is on everybody's mind right now, and especially for pet owners. What advice do you have for pet owners as we're all in quarantine and we're all isolated? Are there things we should be doing for our pets during this time?
Well, this is a great opportunity for you to spend time with your pet that maybe you felt a little bad about when you go to work every day or go to school, that your pet is home by themselves. And now this is like the best thing that ever happened to your dogs and cats. They can hang out with you all day. So it's a chance to throw the ball in the yard a few extra times, take them out for a frisbee, take them on an extra walk. So if you've got a puppy, it's a great time to really concentrate on housebreaking. So we've got some opportunities here, improving their health, their weight loss, all those goals, all those things that you've been meaning to do all along, and you've just never quite gotten around to it.
Now, you actually mentioned a couple things that we've been hearing questions. People are wondering, what if I want to take my dog on a walk outside? Is that okay? What if I have an outdoor cat? Do I need to keep that cat inside? What advice do you have on those questions?
Sure, and we've heard those questions as well. And really, there's nothing about being outside that's dangerous. It's probably the best place that you can be right now. You're separated from people. You can go on a walk and really not have any contact with anyone. So your outdoor cat, if it was appropriate for it to be outside before, it's appropriate still. Going on walks is still safe. I've been doing that with my dog, and I'm in a small community. There's not a lot of people out there. I rarely come across anyone when I'm walking. The great outdoors is a wonderful place for all these viral particles to be dispersed. So we're pretty unlikely to have an exposure. We can stay easily 6 feet away from other people. So it's a great chance for us to go for a run, take the dogs for walks. There's really no limitations on it at this point, as long as the weather's nice.
Absolutely. Now, I know a lot of people are wondering, COVID-19, can it be transferred to your pet? If you're tested positive for this, do you need to stay away from your animal?
Sure. And you can never say never about anything. It's very hard to prove a negative. But at this point, there's absolutely not one shred of evidence that any of these viruses that we're getting as COVID-19 or whatever the variables in that might be at this point, if there's a superimposed influenza or something else going on, there's no indication that any of those are going to be transmissible to our pets, dogs or cats. Now, CDC came out and made a statement that if you're sick, you should try to avoid handling your pet. But there's been no indication that they can harbor the virus, spread the virus, serve as a fomite for the virus, or any other transmission. So really, if you're ill, there's really not a reason that you can't just hang out with your dog. And I know that's not what CDC is saying, but anybody that handles the dog that you've been hanging out with, or a cat, if that's the case, should wash their hands with soap and water, antibacterial soap and water, prior to the time that they handle food, touch their face, handle any of your laundry or any of those things. But we should be washing our hands after we handle our pets anyway. So this really shouldn't be much of a change. And if you're not feeling good, who's going to hang out with you? Like, who's going to stay in the room and make you feel comfortable? Your dog. They're on your feet. They're there. They're there for you. You can talk to them in a way that very few other people in your family are willing to do. So I would say take advantage of that relationship, spend time with them. And like I said, there's been no indication, even on fomites, that there's transmission. Now, a fomite is typically an inanimate object. It's something like a door handle, a toilet seat, those types of surfaces. There's no indication that even one person has had a spread of this virus by touching an inanimate object as a fomite. Now, that being said, we still need to be taking precautions. We should be washing these surfaces first with a soap and then using a disinfectant. Soap alone won't kill the virus, and an antiviral product won't get rid of the organic material. So you need to do a combination of those. But again, there's no fomite transmission that's ever been reported yet with this virus.
Okay, so those puppy snuggles at night and the big sloppy kisses, you say it's all good.
Well, yeah, you probably can't get your dog to gargle before they touch the next person. They do recommend not kissing the dog, not smooching the dog, not getting licked by the dog. And those are all things that make perfect sense. But again, there's no evidence of fomite transmission, and anyone that's handling your dog should just be watching themselves with good personal hygiene before they handle other products like food or their Kleenex or whatever the case may be.
Absolutely. Now let's talk about kind of preparations. What if the isolation and the quarantines, we're not sure how long this is gonna last. And what if your pet has a prescription that they need or, requires vet visits? What advice do you have on that?
Right. And like everything, we want to be prepared, but we don't need to be over prepared either. We're seeing runs at the pharmacy, the lines at the pharmacy are long. People are trying to get their prescriptions filled in advance. People are ordering 6 month supplies of dog food, and it's getting a little crazy. It's right up there with toilet paper and disinfectants and latex gloves. It's gotten just a little probably over the top with preparation, but no one knows what the future holds, and we all want to be careful and thoughtful. But if your pet needs a prescription, we can do refills for your veterinary clinic at the Revival Pharmacy. Most of those products that are prescription, we're going to want to talk to your veterinary clinic about the prescription refills to make sure we've got the right strength, the right quantity, the right instructions. But if you cannot get a hold of your veterinary clinic, we're going to see if we can make some alternative arrangements. And it's going to depend on a case-by-case basis, so we can't make any real significant commitments at this point. But plan ahead. Don't wait until you're down to the last pill in the bottle. Don't wait until you're at the last dose of heartworm or flea and tick medication. Make sure that you're planning in advance. And the same with your pet's food, that you've planned ahead, that you can get your prescription diets ordered, your other foods ordered, and just be prepared. Don't go crazy.
Right. And, transferring a pet's prescription is really easy. I know the Revival Pharmacy, for example, they make it super simple.
Right. Lori and her team of the pharmacy staff are just awesome. So they're going to be doing a great job of communicating and being able to ship those products. As long as we have shipping options, we're going to be able to get those products out to people.
Absolutely. What other advice do you have for preparation for, if you become ill, what you should do with your pet at that time?
Right. And if you live alone, you're going to want to make some arrangements that you have a friend, a colleague, someone else that might be able to help you with the pet, a boarding facility, some of those things. So if you're a single person living with your pets by yourselves, you may want to go ahead and make some arrangements that if you become ill, you'll take care of somebody else's and vice versa. Turnabout. It's just like when parents, help with co-parenting and sharing babysitting duties and teaching duties and all those things, we can all pitch in and help each other. So find some people who have compatible dogs or cats with yours. See if you need to help them out or you can help them. They can help you. If not, then a boarding facility would be appropriate. You may have a family member that's more than happy to take them. But don't wait until you're really down and out and sick before you start thinking about those alternatives.
Absolutely. Planning ahead is key. Well, again, I'm Shelley with the Revival Education Team. This is Dr. Marty Greer. We thank you so much for talking with us today. And if you have any questions, please call us, comment below. Our Pet Care Pros, we've made some changes in our office setting at Revival, but our Pet Care Pros are still there. They are still answering the phones, but they're just 6 feet away from each other now. And so, we're doing what we can to help, and we are here for you. So don't hesitate to reach out.
Hi, if you're watching on YouTube, consider subscribing to the Revival Animal Health YouTube channel. If you have a pet health question, call our Pet Care Pros at this number. And don't miss our other pet health videos.